Zion Torrepalma is barely 2.5 months old and he's already spent weeks in hospital. His parents say he was coughing incessantly.
It wasn't the usual coughing sound. It was a wheezing kind of cough.
Zion was diagnosed with pertussis, a respiratory tract infection more commonly known as whooping cough because of its distinctive sound.
It's a continuous cough, and then it followed by a sudden, prolonged inspiratory effort.
The Philippines has seen a spike in cases. This hospital alone recorded 15 cases in the first 3 months of the year, compared to just 3 for all of 2023. Nationally, the number is nearly 50 times higher. Dozens of infants have died. Whooping cough can be fatal, especially among babies, but doctors say it can be treated effectively, particularly if detected early. And more importantly, it can be prevented by vaccination. Which is why, as part of the government's emergency response, healthcare workers are immunizing children in communities where cases have been confirmed. This baby tested positive.
It's too much for a 1-month-old baby, the antibiotics and injections.
Scientists say low vaccination rates could be why the country is experiencing an outbreak. The UN Children's Agency estimates 1 million Filipino children missed routine vaccinations in 2021 during the height of the coronavirus pandemic.
Healthcare workers had to shift attention to your hospitals, to your COVID-19 isolation facilities. That's one. The babies, their parents had to stay at home. And then you have issues on hesitancy.
Supplies have been running low, but the government says 3 million doses of the vaccine for whooping cough are due to be delivered in the next 3 months, and another 5 million by the end of the year. Zion's parents hope the vaccines arrive before the outbreak gets worse or Zion gets infected again. Barnaby, Al Jazeera, Manila.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.